ये जो बाल्टी है ना, this bucket, this is India. 1.4 billion people, and this small container, this is our healthcare system, our doctors, nurses, hospitals, beds, ventilators, all of that. And today, ghar se, using this bucket and this chota container, let's try to understand Corona in India, where the epidemic is at, what are we doing about it, and what next during and after lockdown. The first thing to understand is this model. In India, when anyone falls ill, they go to the hospital or doctor like this. This is people going for treatment. Okay? If the healthcare system can handle the number of people easily, this is what it looks like. People entering, getting treated, getting cured, and healthy people exiting from the small hole here, all flowing smoothly, efficiently. But if the number of people falling ill suddenly gets too much for the medical system to handle, then this is what happens. Look at it happening. It just goes out of control and pours completely over. This uncontrolled spilling is what happened in Wuhan in January, what's happening right now in Italy, Spain, France, Iran, and of course most massively in the USA. So what about India? What is India's bucket story? Well, the big challenge is this. India's big bucket is very big, 1.4 billion people, and our smaller container is very small. We are short of beds, short of ventilators, our doctors, nurses are short of personal protective equipment or PPE, and even more so when we move away from India's big cities. At the moment in India, some spilling is happening. Some spilling is going on. We've had about 60 deaths. This figure sounds low, but please note these numbers can rise dramatically. Epidemiologists and public health experts look at the rate at which a country's cases double. How many days to go from 40 to 80, 80 to 160 and so on. In the USA, positive cases have doubled every 2 or 3 days since March. The USA had just 124 positive cases on 3rd of March, and in 30 days, they have the most positive cases in the world, over 250,000. In comparison, India has been doubling its positive cases every 4 to 5 days over the last month, from less than 30 cases on the 4th of March to around 2,500 or a little more than that now. But even at this rate, we can reach 80,000 by the end of April, from a seemingly handleable number like 2,500 to an unhandleable 80,000 in just 4 weeks. And this is not unimaginable. This is exactly what has happened in the US, in Italy, and in Spain. But on the plus side, India placed travel bans from countries with high corona numbers quite early. Social distancing, isolation was enforced on those with foreign travel history. Locating and testing anyone with contact history was done vigorously. We also have a much younger population, so maybe we have better resistance. On the minus side, apart from India's limited healthcare capacity, India's corona testing strategy has also been questioned. Mainly that we've tested too few people and not uniformly across the country. There are some states that have conducted relatively few tests. Now, they may have more positive cases, but we may still not know. The other huge step we've taken is the 21-day lockdown, which is why we are standing on this balcony doing this video. 21 days of enforced social distancing. So this will help flatten the curve, meaning it will slow down the rate at which people are falling ill. But while middle-class urban India is following the lockdown, we've all seen videos of thousands of India's urban poor lining up for food, India's migrant laborers crowding bus stations trying to get home or just walking. For them, social distancing has been almost impossible. So how successful will the lockdown finally be in suppressing the spread of the virus is not clear at the moment. Also remember, the lockdown comes at a huge economic cost. Industry, commerce, import, export, agriculture, almost everything is at a standstill right now. No economy can survive such a lockdown for too long. So at some point, can't say when right now, maybe in stages, the lockdown will have to be lifted. What's important is that ye jo India hai na, it must use these 3 weeks of lockdown to make India's smaller container, to make this smaller container bigger, to expand our healthcare capacity on a war footing. more isolation beds, more ventilators, more protective gear and clothing for all doctors and nurses, especially getting all these facilities to reach small towns and rural India where the coronavirus will also reach at some point. Make this small container bigger is our number one aim during the lockdown. If we achieve this, then after the lockdown, though positive cases will still appear every day, at a rate where we can ensure more recovery and fewer deaths. ये जो India है ना, it can defeat Corona and hopefully pay a lower price than other countries have. Till then, stay safe.